Hello, my name is Santos Moreno. I will be doing an assessment on this patient, Miss JG. She's a 28-year-old female. I'll be assessing her head, eyes, nose, mouth, her ears, and her throat. All right, so I'm going to go ahead and start with the head. Her head is an oblong shape, and it appears to be round, symmetrical, no abnormalities. And upon assessment, on her head, she has hair all the way down to her shoulders, no alopecia evident, and no head lice. And go ahead and moving down to her eyes. Her eyes are light brown in color. Do you wear glasses?
No.
Any contacts, anything like that?
No.
Okay. So I will go ahead and get my pen light, and we will assess if she has perla. So okay. All right. So pupils are equal reactive. They are a 3 in size. And upon her assessment, also there's no discoloration on the iris. And upon palpation as well, there is no edema or no discharge on the lacrimal glands. Her conjunctiva are pink in color. No, again, no discoloration, no edema or drainage present. And okay, can you go ahead and follow my finger? Okay. So it's evident that she has all range of motion in her eyes. All fields are intact. And moving down to her nose, at this point in the assessment, I will also include something for the patient to try to distinguish the smell. But upon assessment, also using my pen light, go ahead and tilt your head back. Her nose seems to be symmetrical in shape, no edema present, no discharge. Using my pen light, I'll go look up into her nasal passages seem to be fine, no drainage, no foreign objects in there, no edema. And just to further assess her nasal passages, I'll close one, have her breathe in through the other one, and vice versa. Go ahead and take a breath. All right, go ahead and take a deep breath. All right. So her nasal area seems to be fine. Like I said, no edema, and everything seems to be in order. Moving down to her mouth, her lips seem to be intact. Can you go ahead and open your mouth for me? All right, can you go ahead and stick out your tongue? All right, go ahead and move it left and right, up and down. All right, go ahead and close. So right there, I'm checking the different cranial nerves to see if there's any deviation on her tongue. Go ahead and open your mouth again. Stick out your tongue. Say ah. All right. So at this point, I would also, if you can't assess it with just a pen light, you have a tongue depressor that you can use to assess your patient. And of course, you press down on the tongue to see if there's the gag reflex, and to see if the tonsils are, if they're intact or if they're present. In this case, both of them are present, and they're about 1 in size. They're not touching the uvula. They're even and symmetrical. And it doesn't appear to be any drainage, any other lesions or anything like that present. Her tongue is intact, no lesions, no drainage either. And moving back to her ears, her auricles, she has both of her ears. Auricles are intact, symmetrical, small in size. No external edema, nor external drainage or anything like that. Go ahead and turn your head to the right. All right, and upon assessment, just her tragus, if you have any pain there. You observe the ear canal with, of course, your pen light as well. See if there's any drainage, any edema, any discharge or anything like that. And you assess the other side as well, using your pen light. And everything seems to be fine, no edema, no foreign objects or anything like that. And of course, you want to assess to see if the patient can hear, because a lot of the times they won't tell you that they have or that they use hearing aids. All right, so I'm going to go ahead and cover this ear. Can you hear this?
Yeah.
Can you hear this?
Yeah.
All right, great. So no problems there. Moving down to her neck, her trachea is midline. Go ahead and raise your head a little bit. Her trachea is midline. No distension on her thyroid gland. No masses. Warm to the touch. Skin seems to be intact. And can you go ahead and move your head left and right? Up and down. All right. So range of motion is great. And, all right, so we're gonna go ahead and move from her neck area to, and then assess her lymph nodes. And a lot of the times this may be one of the main things to assess in her head, because they might be sick, and then her lymph nodes might be swollen. So a lot of the times you'll see ear pain with the lymph nodes, only because that pressure from the swelling will radiate to her head. So we have the preocular here, the posterior ocular, the occipital, we have the submental, the submandibular, the submandibular, the jugular digastric, the superficial cervical, the deep cervical, the posterior cervical, and we have the supraclavicular. So all lymph nodes seem to be fine. They're firm. They're movable. No apparent masses upon palpation, and of course no JVD distension. And of course you want to assess the S1, S2, see if you find any bruits. So just real quick, go ahead and stay right there. And using the bell of your stethoscope, you will hear. And you want to assess both sides, of course. Okay, so you should be able to hear the S1 and S2 very clearly. And if you hear anything, a lot of the patients, especially pediatrics, you will be able to easily distinguish the S1, S2, but an S3 as well with a murmur. And of course, that's with pediatrics. And a lot of the times you will be able to distinguish AFib through using the bell and using your assessment skills with the patient. And if you have any questions, please leave any comments, and I'll be here to answer your questions. Thank you.